Hello, everyone, and welcome to another episode of Real Talk with Kid Docs. I am here with my co-host, Dr. Joe Vukin. My name is Dr. Beth Vukin, and we're two pediatricians who also happen to be siblings. And we're just here to talk about some real stuff, real parenting, real kid stuff. And we have a guest on today. My guest is my good friend, Josie Bohling, who also happens to be a licensed marriage and family therapist, who I have known for many years, back when our kids were newborns. Josie and I met when we were in kind of a mom and me sort of new baby group. So when our babies were newborns, and now our babies are 11, going to be 12 here in a little bit. And she's got twins who also happen to have their own neurodivergence and also is a licensed therapist for this. And I love any time that she talks. And so I would love for her to introduce herself, and we're going to talk a little bit about neurodivergence today.
Thanks for having me. This is my favorite topic to talk about, so I'm excited to be here. I am a marriage and family therapist by trade, and I focus mostly on adolescent and teen mental health and family systems, as well as like trauma recovery for teens to adults. So that has been my focus. And in the past, I would say 5 years, I have come into a new specialty, which is neurodivergence, mostly by the virtue that my children are neurodivergent, and kind of an aha moment for me and a deep learning. So I love to share what I've learned, because it can be a very lonely and confusing and overwhelming road. So I'm excited to share with your audience anything I can to help them along the way.
Well, Josie, not only are you super smart and articulate in your field, but yes, I think you've got this unique quality of being the parent of not one, but two girls who have neurodivergence. And I think that's amazing because they're twins, they're fraternal twins. Yeah. And so, I mean, I think I'm fascinated by twin studies, but genetically, siblings, same household, and they're not only neurodivergent like in themselves, but they're also very different from each other, And I just think that's amazing. Like, all of us have two kids, and I just think that it's amazing how different they are, and striking.
As we were chatting just before the podcast began, and then also in your intro there, I also had that same thought, because with twins, well, with kids in general, exactly like you said, my two kids are very different, but also have their similarities. And then when it comes to their behaviors that may or may not be something to be concerned about, it's like, well, is one quote unquote neurotypical or normal, and then the other is off a little bit? Or how do we compare the two? Or are they both presenting in different ways of the same thing? Or it can be a little bit confusing. So I'm interested to hear about that story as we move along too.
Yeah,
this is gonna be a fun episode.
Very confusing, particularly because they were my first kids, so I didn't have any for what is neurotypical and what is neurodivergent. So
right.
And what is kind of like, we'll talk a lot about with neurodivergence, is can be a lot of like emotional reactivity and instability. And so when you have kids that are the same age, you don't have the advantage of one being a little more mature and a little more emotionally regulated the other. So it's been a challenge.
Exactly. That was another great point, because I was thinking people have siblings, but generally they're not the same age. And right. So you're like, oh, well, this one is 12 and this one's 9. That's why they're having these issues. Or this one is a toddler and having some difficulty. But yeah, when they're the same age and they behave and emotionally regulate differently. Whew. So let's get started. Josie, tell us just a little bit about your training, first of all, and kind of like who and what you see. And then, your story with your own kids.
Okay, so marriage and family therapists, our basic training is in a very humanistic, client-centered approach, but we're mostly looking when someone comes into our therapy office. If they come in solo, we're getting really still very curious about the environment that they come from, their family system, their home life, their culture beyond their house. We're looking at the whole environment. Do they live in a town or a city? Like all of that. We kind of want to just go boom, boom, boom. We're curious about how all of those pieces impact their current experience. And we focus a lot on communication within and how to just kind of strengthen your communication to the people that you're living with and your understanding of yourself. So in that way, we start to get kind of like all mental health practitioners, which is that we end up kind of helping people kind of understand their own experience in a more deep way and helping them identify skills to kind of meet their goals. So I also have a lot of training in trauma recovery, which is a lot about the nervous system, and as well as somatics, which is also about kind of watching the body and learning when somebody is having a hard time or distressed or struck. So those turn out to both actually be very helpful base trainings in understanding neurodiversity, which we'll get into because they have neurodivergence is a lot, particularly at a parent level, about understanding your child's nervous system. So anyway, so that's my my professional work. I kind of actually neurodivergence started to come into more focus for me just before I realized one of my daughters was autistic, because I noticed I started having I always had a lot of teenage girls that would come into my office that would present as anxious or depressed or struggling with friendships. And I would find them quite lovely to spend time with. But I found it was also really difficult to kind of get into the nitty gritty details of like what was the miss for them, kind of interpersonally, whether it was their friends or their family system. And maybe some of them would I could say like, oh yeah, they were the quirky girl. I could see where they might not kind of fully jive with every person. But I would also find that a lot of my treatment modalities that I was trained to do were not helping. So this was that subsection where I'd just be like, darn it, I just really feel like I didn't kind of get to resolving that main concern. And as we will talk about, like a lot of these kids were either ADHD or autistic level 1, which is an autism diagnosis that generally comes with a very high IQ, as well as needing very few supports. So it started to kind of come into view for me that, like these kids are autistic. And realizing like I hit a dead end with them. Like, I don't have any training in this. LMFTs, and you'll find that with like most mental health professionals, we don't have specialized training in this type of thing. So I had to kind of go on my own hunt and found a lot of allies for this, whether it was made a lot of friends with neuropsych assessors and kind of had to start to train myself. And pretty soon along the way, I realized, oh, wait a minute, my daughter is also autistic. So they kind of had a confluence pretty close to one another. And it made me pretty motivated to start to be able to really support this population. Yeah.
So Josie, before you go on, I feel like the words autism and neurodivergence are thrown around a lot these days, and they're used sort of interchangeably, and they're used for a lot of different things. Can you help if a parent is listening to this and they're like wondering, like, gosh, I wonder if my child, like a lot of people will just wonder and they don't know necessarily what it is. They'll just know something's different.
Right.
What do those terms mean to you, and how do people classify? I guess, how do you use those terms?
Right. Okay. So neurodivergence does not only include autism, although you're right. That's like in the common conversations, that is like the most commonly linked. So there's a woman named Judy Singer she was a sociologist, and she actually first coined the term neurodiversity. And that basically just means that the recognition like, oh, hey, brains are all different. And that kind of is why we see variations in interests, in learning styles, in energy styles. Like that's kind of, and so it's just acknowledging that there is a diversity. And then neurodivergence is, hey, we generally have like a norm of what we see. A neurotypical is the word that is used often. And anybody who's neurodivergent is off of that norm that we agree upon, which that's like a whole bee's nest of issues. But you can expect neurodivergence is about 15 to 20% of the population. So that's a huge amount of kids. huge amount of people that are walking around the world and often experiencing a lot of like questions about why is my experience different than this, and a lot of shame over their lives about why can't I be like this, either for themselves or that's the feedback that they're getting from others. So anyway, does that answer the question? Is that helpful?
So, let me follow up on a quick part.
Yeah.
So I often think of autism, ADHD as diagnosable conditions under neurodivergence. But do I understand also that it could be somebody with characteristics that aren't diagnosable of anything? It's just I'm kind of off of a neurotypical trajectory, and it's nothing that's impacting my life aside from maybe the recognition that I'm a little bit different or special in other ways?
I mean, that would be a very broad way to look at it. We do have the ability to kind of zero in on kind of what those variations look like.
Yeah.
So I'll tell you from like there's definitely a recognized medical and kind of psychological presentations of neurodiversity.
Okay.
And then there's also this whole other subset where people are starting to say, hey, trauma actually makes my brain work differently. And so that's a neurodivergence. And that's why I can expect. So I'm not going to veer into that so much. I think for our audience, it's more about recognizing some of the common neurodivergence that we see in kids. So that would fall under the umbrella of ADHD, autism, dyslexia, gifted kids. And then I don't know if I should but gender fluidity is also very common in the neurodivergence umbrella. So those are kind of some of the terms that we fall under. You could also say like OCD, bipolar, but those are going to be things for your audience that are kind of getting into the weeds. I think it's a much more common for peds for you guys to first see like autism, ADHD, dyslexia, gifted. You're going to be able to kind of sort those out and start to see those as a parent pretty within the elementary years. And I think that's another thing to recognize is that a lot of these are not truly earliest diagnosis is about third grade at this point. And I think our diagnostic skills are getting better in terms of, but a lot of these kids are that we're going to talk about that go through the cracks are generally have average to high intelligence. They generally have good enough social skills. And so they're really just cooking along just fine until about third grade, when the demands around social skills and academics start to get a little more demanding. And we can kind of talk about what those clues are. So does that?
I love that. And I'm just going to recap that and highlight a couple of the things that you said. So under neurodivergence, we're talking about things that include autism, ADHD, dyslexia, gifted, and often these kids have gender fluidity as a component as well, or not often, but can.
But a small portion of
a small portion. And often have average to high intelligence and good enough social skills that they often aren't picked up necessarily until around third grade, which actually makes me think of a couple of the episodes that we did with Dr. Molly McBoy about ADHD and how boys are often picked up very early because they're very hyperactive, but girls or the more inattentive type tend to be picked up more around third grade, fifth grade, as social demands on them are changing and more difficult. So that's an excellent one. So, okay. So now where should we go, Josie? From there, that's around the age that they pick up. You tell me.
I could start to do is just kind of talk a little bit more about like what neurodivergence some of the clues and what that can start to look like, and what
that would be great.
Start to notice.
Yes.
Okay. So I like to divide it up in terms of like, I'm just going to give you a little criteria and then we can kind of get into the weeds. So you tend to see a development rate starts to kind of seem like, oh, they're a little behind either in their coordination, their aptitude with reading, their just like emotional maturity. You might see like a spike, what we call a spiky profile. So, hey, my kid's amazing at math, but the reading is not coming along at all, or vice versa. My kid is amazing at reading and math is just completely out of reach. In fact, they're starting to have social anxiety, which was my first clue with my daughter. She is one of my daughters. She's gifted. So verbally was like using 5-syllable words at 5. And everybody was like, wow, that's a cute parlor trick. And nobody really said anything about it. And she like read, it seems like she just kind of like read there and learned how to read. And so her experience was that she loves school and she's very social. But it wasn't until 3rd grade when math started to get more demanding that she started having these little social anxiety episodes. And so that was the first clue. So that spiky profile is really, so that can show up like also with language. Some kids can be incredibly adept at like manipulation. You might have a very engineered minded kid who's like can figure out any problem, but then there's a language delay. Another clue is actually co-occurs a lot are speech, small little speech impediments can sometimes be a flag like, oh, hey, there's something going on. So those are developmental rates. The other thing that comes along is processing styles. So you might notice that a kid has a slower processing speed. They understand, but you're noticing that they're like taking a little bit longer to respond, or they understand the topic, but their sentence structure and the way they put the response back is a little more jumbled. So processing speed and working memory are really big indicators. If you're noticing your kid, like once you get to like elementary school, they're starting to memorize like math facts and spelling. And if you notice like your kid, you're like, wow, we went over this, and it's not sticking. That's usually a working memory issue. And then the other developmental delay is inhibition. So that kind of you tend to see that a lot in ADHD, where you're just like, wow, my kid seems to like, they're already at an age, maybe like 2nd grade, and they still and then they feel remorse, but they seem like they can't quite control themselves in the moment. That can be a delayed in inhibition that's really common in ADHD. And then another one is cognitive flexibility, where you're like, wow, it seemed really on par that my kid was getting frustrated and unwilling to transition at kindergarten, but it seems like it's still there. Like, and it's still hard to get out of the house, or still hard to move on, let go of an activity, even in 2nd, 3rd, 4th grade. Those are all clues like, something's going on. And then the other one that is, I think a little trickier for people to catch, but is upon hindsight, people are always like, oh yeah, that was there, is sensory processing. So a lot of times we look at, particularly we think of autism as the one place where sensory processing is going to be. And we often think of it as being really, really profound and accentuated. But for a lot of these kids that are the lower needs is the way to say it, lower needs, neurodivergent kids, the sensory stuff is more subtle. Like maybe it's not like no clothes, but it's a preference for tight clothes. Maybe it's a preference for certain socks, or maybe it's a preference for like, oh, it's too loud in here, I'm going to go just read by myself. Or you might just notice them starting to manage that, like sound, light, and then the other one is food. So a lot of more pickiness around food, where you're like, oh, I've exposed my kid to a lot of things, but they continue to just have these very limited preferences. Those are all indications. Those show up a lot in autism and ADHD. So let's see, reel me in. How are we doing? Is that?
Yeah, I had a question I wanted to clarify. I love the way that so the things that you talked about, little things that you might start to notice, your kid's a little bit behind developmentally in any sort of development. That could be a little behind in gross motor skills, fine motor skills, social skills, language skills, a little bit delayed. They can have the spiky profile, like they're really good at some things, but not good at other things. And I think this is where it really does help. You said you're a lot of friends with some neuropsych testers. Having people, like, you need to see other kids of that age. And I think that is really challenging. And so, because a lot of the things that you were saying are also very common in children of certain ages. And so is it like, when do you grow out of being picky about your shirt? Like when, and so yes, I love that. And then also the sensory processing, things are too loud, things are, textures are issues, foods are issues, certain colors, certain things touching them are issues.
Yeah. So I think it's important to say everything that I'm saying, if it's just one thing, we're not looking at one trait, we're looking at a cluster of traits. So I don't want anybody to go like, oh my gosh, my kid doesn't eat this food. That must mean that we're looking at we're looking at like traits in all of these domains. And so that's really helpful. If you're at all curious, it's really great to to start with a pediatrician, to start talking to a teacher, because another thing is that kids often present differently in different environments. So my experience was that I was seeing all these challenges with my kid at home, and then she'd go to school and she'd be fine. Both of my kids, actually. So for references, I'm referring to them. One of my daughters has an NVLD, which is the other one I didn't put in there. It's totally rabbit hole. Nonverbal learning disability and autism. And then the other one has a diagnosis with ADHD and dyslexia. So both of them, when I would refer to the teachers, they were like, oh my gosh, they're lovely. No problems. What are you talking about? But at home, I was having a lot of issues. So that's another place to kind of get curious. Like, when am I seeing these challenges showing up? And you really want to start to talk to lots of different people about it. And I will say, with a caveat, like, I think a lot of these, I would encourage all these listeners to look for practitioners who have a specialty in neurodiversity, because it is really still a growing field. I feel like in the past 5 to 10 years, I like to call it the Enlightenment era. So not all practitioners, doctors, mental health practitioners, even neuropsych assessors understand the early presentations of these. So you could, and I have personally gone to people about this and got, oh no, everything's fine, because these presentations are just so much more subtle. So you really want to start, if you're going to go to your pediatrician, that's a great place to start. But it's really important that you ask your pediatrician, do you have an experience or a training in neurodivergence, in particularly high functioning or low needs presentations? Because a lot of these kids are going to miss, you'll do the standard screeners and they'll just blow right past them, particularly girls. So it's really important that even if you get a no from one practitioner, but you're still like, something doesn't quite feel right, keep going, keep asking, because this really is hard to nail down, particularly at the younger ages.
I will say too, as a pediatrician, and for someone who has graduated more recently than some of my, colleagues, so feeling quite comfortable treating ADHD in particular and diagnosing and such, there's still a lot that I don't know. And reading through neuropsych evals and such, which actually sounds very similar to all of the criteria that you had just said. It's, oh my gosh, these sound like all the ones that I've read. 25 pages of stuff that I wouldn't even begin to know half of the tests that they're performing only by name now, and over years learning them. But there is, I guess this comment is meant to reiterate what you said. If the parents who are listening have a hesitation, or just still get that gut feeling that I checked with my pediatrician, or I checked with XYZ person and it didn't seem like anything was coming of it, but I just feel like something's not quite right. Keep on pushing. You know your child better than anyone ever will. And it is the privilege of being a parent to be in charge, and it is on you to keep going with it and to find that next person to help you out. And then all the pediatricians or other health people out there, be humbled in the sense that you don't know everything, and you can learn from lots of people out there.
Yeah, I think there's more training now. I'm hearing more and more. I often ask, when people ask if they should go get a neuropsych assessment to really understand more thoroughly, I really encourage people to vet their neuropsych assessor and ask those questions like, do you have training in neurodivergence, and what does that look like, and are you comfortable with these lower support needs presentations? And that's okay to ask that question.
Oh yeah.
So now, Josie, if I'm a parent and I'm noticing some of these things, we talked about, like, we can go to our pediatrician and talk to your child's, teachers, coaches, piano teacher, all of the people in their lives. Then, well, actually, before we leave that, I also just wanted to put one more plug in for Believe in Yourself. So my son, who's the same age as Josie's girl, so almost 12, has ADHD, which I had an inkling of many years ago. My husband is a psychiatrist. He's an adult psychiatrist. And for years, I felt like I was the one who was seeing things that he wasn't, because I was asking him about a lot of these behaviors that Josie was mentioning. I was like, gosh, I feel like there's something amiss. And same thing, all of his teachers, every grade, every coach, every instructor, great. He's great. I'm like, oh, wow, I just really feel like there's some of these things. And he has actually given me permission the other night at dinner. He said, Mom, you can talk about me having ADHD on the podcast. And I was like, oh, that is really nice of you. And I think it's because he thinks like it'll help people, right? Like, I think once we got him treated for ADHD and talked about it, and now like he has that language of like, this is how my brain works. And so we can use that. I think it's actually really beneficial. And so being really open with it. I feel like now people are going to be talking about their diagnoses, just like we talk about their pronouns and their, like I have this, and like, it's very helpful to contextualize. And so I'm a pediatrician. I'm married to a psychiatrist. I had many, many, many people tell me that my child was A-okay, and I felt like there was something different. And it took me actually having Dr. Molly McBoy on the podcast, and that's what I did. And so like, talk to me more about this. And so learning more about it from other people. I think I'm just going to re-encourage that. So if you're a parent and you feel like something is amiss, or if other people think that something is amiss and you don't, like, I think having a trained professional do some neuropsych testing. So now, Josie, like, what does that look like? What is that involved? How do you do that?
So there's two avenues to go down. And I like to look at this in terms of need, like, what's your goal? Like, do you need a neuropsych assessment? Needs to first be answered, like, with what is the goal? What are we trying to attain here? And if it's a lot of people, just from an economic standpoint, they're really expensive, and not all insurance cover them. So I think usually kids are struggling most in a school setting once they get to the higher grades, and that's where they start to feel a lot more shame and kind of the sense of I'm different and I'm not keeping up. And so it can be actually more effective to first ask the school to do some assessments. And it's important to know that as schools are not going to offer you assessments, but they are mandated to provide them, federally mandated to provide them if you ask for them. So go ahead.
I just want to underscore that, Josie. I want to underscore that. Talking to several friends who are teachers and kind of going through this with my own son, I brought it up and said, like, well, don't you think the teacher would have brought it up to us?
Right.
And that, I have learned from my teacher friends that they are actually not allowed to, even if they are concerned that your child might have a learning disability or ADHD or anything else. They actually are not supposed to bring it up.
Which is such a tragedy. I just have to say,
it's such a tragedy. It's like I go to the doctor, and if they found something wrong with me, I feel like they should say something. And it's kind of like the same thing with the teacher.
of all the practitioners who know variation of children's behaviors at a nuanced
Mm-hmm.
level, I can't think of more highly trained people than teachers. They see
Yes.
30 kids every year. They see the whole range. And we,
Yes.
as a population, are not allowed to tap into their training and insight. It's a whole legal rabbit hole that I don't totally understand. But
Is
yeah,
that state
it's true.
specific? Because that sounds outrageously inappropriate.
No.
Yeah. And the other interesting thing is that even if you ask, so my understanding is that some of it has to do with like HIPAA stuff, like just
Mm-hmm.
that they aren't trained to diagnose. So some of it has to do with like overreach. Some of it has to do with funding. So where it's kind of maybe more like a localized or school specific thing where they don't want teachers bringing it up because it's very to provide specialized education plans for each student does require a lot more workforce.
Mm-hmm.
It requires more testing, which is expensive. It often requires more kind of assistance from other modalities like OT, speech, and then specific to the academics or having assistants in the room. So there can be, I've heard from like anecdotally that there can be just like in school pressure, like do not overstep this because if, if you think about it, 15 to 20% of the population of kids, that's a lot. And so I think there's a lot more emphasis on teacher trainings to try to teach to the variation and stay away from identifying diagnosis and addressing it from that point of view.
Yeah. Which I can appreciate too, but yeah, I totally agree with you, Josie. If there's anyone qualified to pick those kids out. So I guess I just want to underscore that for everyone. If you are having any thoughts, bring it up to your teachers and see what they're seeing, and that they, all schools, particularly public schools, but I think all schools actually are mandated to provide some sort of testing or resources for you if you bring it up as a parent.
Yeah. So if you just ask for it and they say, no, we don't think so, you can say, yep, but I still want that.
You still want it.
They need to they're federally mandated to do that testing. And that then is your taxpayer money. Like, so if that's a first stop. And if you feel like, okay, this has gotten us what we need, my kid's getting the support and interventions that we need, then you may just stop there. Right. Reasons to go on to a neuropsych assessment is if you feel like you're needing it's not quite answering all the questions. You need a more in-depth understanding to get maybe more supports for your kid at school that you feel like aren't being addressed, or maybe at home you're having your own challenges and you're wanting a more in-depth understanding of what's going on for them. A neuropsych assessment can also medically get you for insurance covered, can start to pull in things like referrals for OT, which is occupational therapy, mental health therapy, speech therapy. Depending on your insurance coverage, you may need the diagnosis in order to get those services. So that would be the why for the next piece. So another way to conceptualize this is that the education system and the way they understand neurodivergence is very different. Their assessments are, is this interfering with their education? And so they actually use different parameters, different language, than the medical model. So that's why that isn't going to be sufficient for insurance coverage. You're going to need the medical language and then medical diagnoses to get further services in your insurances. And sometimes you'll need the medical diagnosis, to then leverage more services at school. Sometimes they'll ask for that. And then to be aware that even if you ask for assessments at school, the things that most schools can't diagnose is ADHD and dyslexia, which was the case for my ADHD dyslexic child. They did all the assessments. She's at grade level, but she was still, so they never provided her services, but she was still struggling. So they gave her what's called accommodations, but there was still these questions like, well, why is she struggling to spell? Why can't she understand everything, but she can't spell? Or why is she so anxious or needing more time? All of those questions, some of those weren't totally answered. And so we had to then go further into the medical field to get those questions answered and to get the interventions that she needed that the school couldn't provide.
And
Okay, so I'm hearing, as a parent, you'd start with the pediatrician, start with school.
Yes.
And see what those can get you. And Joe, being pediatricians, a pediatrician can diagnose ADHD, autism. We've got some validated screeners for those things as well. And can be younger than school age too. That's a great time to reach out to your pediatrician. Joe, did you have something that you
I was going to say, so the stuff that you're talking about, IEPs and 504s, gosh, we could have
a whole other session.
Lots of other sessions, on those. And maybe we should, but those can be complex and cumbersome and require a lot of time and input from all of the resources that you had just said. But for parents listening, you're probably going to be familiar with those as acronyms, IEP and 504s.
Mm-hmm. Yeah. And really the reason for our conversation around neurodiversity just today, what is it? One of the big things is about bringing in kind of a positive, developing a positive identity for these kids. And so where 504s and IEPs become helpful is creating a sense of positive identity and self-advocacy for these kids at a really early age. So I'll just bookend it right there, but that's kind of where you start to go into one of those interventions. That's how you can attain that less shame and more self-advocacy and understanding.
Yeah, I definitely, so we're planning some more podcast episodes for resources where I'd love to go into more of the IEP and 504. So IEP is an individualized education program?
Correct.
And who is that developed by? Is that developed by the school, the teacher?
Mm-hmm. Yeah, so it's usually a multi-mode cross-discipline approach. It's usually a group of like the special education teacher, and it will be determined who comes in depending on what the need is. So it could be a speech therapist, it could be an occupational therapist, it could be the standard special education teacher who can do reading and math. The neuro, and then every school has a psychologist, a school psychologist. So those are usually the people that show up at those meetings, as well as you. And if you want, because it's an incredibly confusing and overwhelming experience to be part of, there are always parent advocates, local groups that have done it 100 times that will attend those meetings with you.
Oh,
yeah, there's consultancy groups that have started up nonprofits or for-profit businesses to advocate for families because it can be quite a confusing process.
Definitely.
Yeah. Well, let's kind of bring it home then into now that we've opened a can of worms and there's these things, we've got all these questions. I love that you are seeing it in a light of this is how your child's brain works and this is working with them. So where do you go now that you're okay, now I've got these things in my mind.
Right.
How do I frame it? Because the thing that I like really about the therapy that you do is you talk about treating the family and teaching parents how to interact with their child. And so how would you
so I think
to leave us with that?
People always say, well, why would I diagnose my kid? And why is that even helpful? They're just themselves and I don't want to put labels on them and I don't want to medicalize it. And there's absolutely 100% that is an incredibly understandable reason because we don't want to put a sense of shame in there being any difference. In fact, that's the exact opposite. What we're trying to say is, hey, your difference is actually a strength. And so diagnosis can help you be more pinpointed about what are the things that I can do to support my kid. So in my approach, what I have found is that neuroaffirming mental health care is absolutely essential. So finding if you have a kid who is neurodivergent, it's really important to start having them interact with teachers, mental health professionals, coaches, whatever, that understand their neurodivergence and give them positive reflections about that are more strength-based. And say wow, I love how creative you are. I love how passionate you are. I love the way you think about that in this way that I had never thought of. So just trying to kind of pull out the strengths, because so often these kids get a lot of feedback that's deficit based. And so the other thing that I love to do with families is start to, it's not about like a mental health treatment. It's more about psychoeducation. Like, what does it mean to be neurodiverse? You have to start to take your expectations about what is normal and pause and start to say, well, what does it mean to be this person? And how can I appreciate and validate and celebrate who they are and not make them fit into this other hole that they are not and they will never attain. So this has become a really big passion of mine, because in my practice, so many of the times that I get teenagers, they've already just internalized and lived with a life of shame. Mm-hmm. And that is why they come to my office with anxiety, depression, self-harm, impulsivity, addiction issues. And so I feel really passionate about the fact that if we can catch these kids a lot sooner and start to raise them in family environments that really celebrate and understand who they are, I think I'm going to see a lot less of those kids showing up in my office with those more extreme presentations. And I think it's all about if there's a frontline intervention that you get, it's first about finding how do I create a neuroaffirming experience in my home with my kid. And so that's why I love diagnoses, because it helps you truly understand what to expect instead of being frustrated and like something's off, or my kid. So often these kids are blamed for having bad character. Or the classic one is that parents will say like, I must have parented wrong. I must have done it wrong. My kid's not following in their instructions. I've told them over and over. It must be my fault. And it takes all of that shame and just lets it go. And allows us to say, okay, let's use a different ruler. Say like, what does this really look like? If I step back and I let my kid be dyslexic, what does that look like? And what are my expectations then? Actually, they're actually trying really hard. Most kids are trying their best all the time. And they don't want to disappoint us. So if we start to have labels like, oh, my kid is actually ADHD, then as a parent, I can go, I can expect them to be impulsive. I can expect that their emotion regulation is going to take a little longer to come on board. And that's not because they're a bad kid. And if I expect it, I'm going to get less frustrated. I'm going to use less shaming words. I'm going to be able prepared to give them more intervention, like redirects in a way that's supportive. So I hope that helps. Or the same, I guess the other one would be autism. Like, oh, my kid doesn't love big groups. That's okay. Most autistic people are not really big into like large group events. I don't need to make my kid love a large event at all. No, that's not a precursor for being a good, successful human. So I can let that go.
And Beth, we've heard this an awful lot too, starting with Molly and then on through, and this just reinforces it. We have some great guests on the show. And I don't think to reinforce what we're hearing in an echo chamber of our own, sort of curating, but, the idea that meeting kids where they are, understanding them, and then adjusting our expectations to their behavior, and that also supporting, kind of going forward. I love what you just said there, Josie. That's perfect.
Great. I'm so glad.
Yeah, exactly. I tell myself, like with all kid behavior, I love that you said that they're always trying their best. Because I always have to, when my kids are acting up, I have to remind myself they're not doing it on purpose to make me mad. It's like that. It feels like it sometimes. It feels like, that's going to make me upset. Right. And it's that their brain, that's the way they process it. And so giving them the tools to help them process and learn and regulate in the way that works for their brain, and not necessarily. So, I hate this like normal divergent sort of situation, but people work a little bit differently, and not everybody learns the same way, and being more accepting of that, I think is becoming the way that we're going. And the labeling, the diagnosis, it helps get you resources. That's, I think the pediatrician's angle, we're always like, it'll help get you resources. But and it is it is just giving you more insight. If someone could give you like a little bit of a manual into like how your kid works, it is like your kids like who have brains like this tend to do better in this school setting, tend to do better with this type of instruction, you know, like, and then it just gives you a leg up as a parent so that you're not just trying different things.
Right. I think the other thing I want to put a plug in for parents is grief. And so often it is hard we feel fear that our children are the variant. They're just a little bit different than the norm. And we fear for them that they're going to be a struggle. And so we want to protect them and make it easier. And sometimes that protection looks like denying what's actually happening. And I think it's really reasonable. And I think it's just important to recognize that even when we're supporting our kids, we're going through our own process and our own struggle around what it means to have a kid who we know is going to have maybe a few more bumps and scrapes along the way, maybe have less experiences of acceptance and understanding along the way. So that's sort of my mental health piece too. I think as a therapist, I spend a lot of time with parents who are really struggling with the acceptance and the grief around this journey that they're on. This is hard and it's isolating at times.
Well, Josie, thank you for bringing to light this topic. And it's the first of many discussions. And actually, you are practicing right here in Salt Lake City, and I think you're accepting patients. And so we'll put your contact info in our show notes as well. And if any of our listeners have more questions, thoughts on topics for Josie Bohling or for us or just in general, please reach out to us at realtalkwithkiddocs@gmail.com or on our social media. Josie, thank you so much for your time, and I look forward to talking to you again.
Great. Thanks, Josie.
Thank you.